afternoon and welcome to CIO Leadership Live. I'm Mary Fran Johnson, the Executive Director of CIO Programs here at IDG. And I'm very pleased and honored today to be joined by Randy Gaborio, who is the CIO and Senior Vice President of Innovation and Strategic Development at Christiana Care Health Systems. Christiana Care is a not-for-profit healthcare system headquartered in Wilmington, Delaware. It employs nearly 12,000 people across an extensive network of outpatient services, home health care, medical aid units, and 2 major hospitals. Just this month, Forbes magazine ranked Christiana Care as the #1 employer in Delaware in its inaugural list of America's best employers by state. Before he joined Christiana in 2010, Randy spent 12 years with Teleflex, a medical device provider, where he was the CIO, the Senior VP, and the Strategic Development Officer. His CIO experience in other high-reliability industries spans aviation, manufacturing, and automotive. Since 2015, he has also served on the adjunct faculty at Dartmouth College's School of Medicine, and for the past 8 years, he has chaired the nation's first and most advanced health information exchange, the Delaware Health Information Network. Randy is a 4-time winner of our annual CIO 100 Innovation Awards, and next month we're going to induct him into our CIO Hall of Fame. I once referred to him in a CIO magazine editorial as one of those exceedingly rare triple threat CIOs. He is equally talented at leading and managing, problem solving, and driving revenue. Welcome.
Thank you, Mary Fran.
We have the very impressive Mr. Gaborio
Thank you.
today.
You're too kind.
Well, it's always a delight talking with you, and there has been such a huge volume of interviews and things that people have been talking about to you over the years, and it's great to have you here in person.
Thank you to you and your team for having me.
Our pleasure. Now, one of the things I noticed when I was doing a little research for our conversation today, that Christiana Cares, the way the company describes itself in that, that template that you use and you see it in all the press releases, it refers to itself using a reference to its unique data-powered care coordination services and also a mission of shaping the future of healthcare, which you get the impression that IT and technology has a great deal to do with that. And let's talk a little bit about what that means, that data-powered care, and how you see the future of healthcare being shaped by all the disruption in technology today.
Well, let's actually start out with a really interesting point where you talk about just the word disruption.
Mm-hmm.
And, the sort of the framing of disruption, right, it's a term that we're using everywhere.
Yes.
And so I tend to sort of think about disruption in a way that is how prepared are you for changes that are coming? And we sort of try to think about using, say, innovation as a way to immunize ourselves against disruption. Now, there's no foolproof way to insulate yourself from all changes, but we really try to understand and forecast what does the future look like.
Yeah.
And that comes right into this concept of data-powered healthcare. So back in 2012, we began with sort of a seed concept of this challenge with a particular population of patients, patients that experienced a cardiac event, were discharged into the home setting, but a particular segment of those people in that broad category, a fair number were returning within 7 days post-discharge, and something around the number of 80% were back in the hospital within 365 days. So we pondered that question along with our
heavy data, right?
Pretty
there,
heavy data.
yeah.
And so along with our clinical partners, we sort of posed this thesis of like, there should be enough information out there for us to be able to begin to sort of understand or predict who might those people be, and can we figure out before they show up at the emergency room door, can we figure out who they might be before that? Can we get upstream?
Yeah.
And so we began a journey at that time to sort of build the capability to sort of begin caring for people under that model. And we've had some great results out of that. And I think one of the interesting outcomes here is our ability to sort of understand and predict who is at the highest risk for returning, and then taking an appropriate sort of intervention, and an intervention that actually could improve care, drive better outcomes, and potentially reduce the cost of care for those patients. Because when you show up at the emergency room, that's the highest cost venue for care.
That's right.
So,
that's right. Urgent care.
So when we did that work, what we discovered is those people that were at the highest risk, we determined in that case to send a home health nurse out X number of days post-discharge and a couple of days before that risk period, before they showed up. And we determined that some of those patients were retaining fluid. So we sent the home health nurse out to basically introduce the therapeutic of a diuretic to help rid the people of fluid. And interestingly, now we're sort of on a second generation of that. Now at the time of discharge, that we do a daily dynamic risk score on these patients. And at the point of discharge, we actually send them home with a diuretic now. And they're told, because they enter a sort of a care management platform, and basically it's, break this open in the event that we tell you, break the glass in case of emergency.
Yeah.
So we've been able to actually reduce the cost of care, and we've improved the outcome in that scenario. And that's really this thesis of data-powered healthcare.
Yes. Well, and that it's not something that the IT group is doing all by itself. It's not. So what is the structure that you use to get this information back and forth with the caregivers, the nurses, the doctors, the administrators of the hospital?
So there's a bucket of data that exists. And there's sort of this bucket one, which is sort of all the data.
It's probably the biggest bucket in any organization.
Well,
it is.
It's a great point. And in this particular bucket, there's a whole sort of set of ingredients that go in from a data perspective that today's American healthcare system sort of has controlled, if you will. Like we order the test, the diagnostic, the therapeutic, the imaging study, and the like. So a lot of it is first this collection of the data that we create, and that is data that we've captured, we can bring in. But then there's this next generation of complexity of data that when you think about healthcare, right, the venue of care, we do these things in our world. We order the test when you're in the hospital or in our settings, or we send you out to a place, an imaging lab to get this work done. But then you have this concept now of where you need to actually gather data that is being generated outside the four walls of the hospital.
Okay.
And so it's actually caused for us to sort of rethink moving from a data producer to really a data consumer. So we have to think about building a reversal of the information supply chain. So how do we begin to bring data in from the outside world where you live in the community setting when you are suffering from chronic disease, or you're that post-acute patient from that cardiac incident? And so how do we build that structure? So it requires clinical data that we create, data from the home setting, and we also engage in a technology called the Health Information Exchange. And in states here in Massachusetts and in Delaware and other states, it's an ability to sort of connect data that is from the ambulatory settings and the labs. It's really the concept of, it's the patient's story lives across these different sort of venues of care. So it's about bringing that data together to be able to then do the prediction work.
Well, and it's obviously very important that it's both structured and unstructured data. And of course, it must be made a lot easier today by that little supercomputer we have in our hands. I think of now, you go to the doctor and you get some tests done, and later in the day, you can look on your mobile app. Most healthcare organizations, I know in the Boston area, that's certainly true. You can basically go in and see your test results, which may or may not help you because you may not know what the numbers mean. But the idea of exchange of data and the ability to see all your stuff.
That ability. Interestingly, that there's an element to that which is also this overarching sort of narrative around consumer-driven everything in our world, and really meeting people with the information in the way that they want to receive information.
Meeting the customer where they live.
Exactly, meet the customer. So we talk about your ability to hop on that app or the portal of your provider to be able to supply that information. And now, where Apple is in this world now, where you can actually have your health records really actually digitally loaded directly onto that asset that you're carrying as well. So what it does, it really creates a sort of a vector of a way of connecting with the people that you serve. And in a lot of ways, it now really becomes the most important vector of care because it's always with you, versus when you think about today, for example, for diabetic care. For diabetes, the standard of care is every 90 days your hemoglobin A1C is checked. You show up at the office, the clinician has a conversation with you. Mary Fran, you're not keeping up with your regimen.
Did you eat a cupcake before you came in here?
So we see this thesis around of actually being able to improve the connectivity of care and the quality of care through this thesis we call high tech, high touch.
Yes.
So if every 90 days you're seeing, your clinician for diabetes, imagine, an IoT-based connected device that's connected to basically a surveilling algorithm, if you will, that's paying attention to your diagnostics. And then that can connect you real time to somebody who's a coach for you that says, we've seen that there's a spike in your blood glucose.
Yeah.
How can we help? What's going on, Mary Fran? And so that really means the venue of care shifts from sort of from real estate, physical real estate, to actually the real estate that's on the screen in front of you.
Yes. Well, and that gets into what I've heard. It gets referred to very broadly as virtual care. And, that movement of the relationship between the physical and the real estate and you told me one really kind of shocking thing, that 35% of patient admissions that you have today in hospitals will be completely gone in 5 years. And that's a big revenue impact as well. So when you look at issues like that, what is the thinking at Christiana Care, and how do you kind of enter into discussions thinking about?
So part of that also goes along with, in healthcare, we're changing both the clinical delivery model and how that is shifting from inpatient, where, our relationship with people have been, when you are sick and in need, cross our threshold, and we have an amazing infrastructure to repair you. But where we haven't in America sort of solved a lot of the problems, this really is the epidemic around the chronic disease state. And approximately 81% of the beds of inpatient facilities across America are filled with people who are suffering from comorbid conditions associated with chronic disease, complexity in that way. So we talk about sort of this concept of inpatient admissions going away, but that needs to be wrapped with what we're calling a commerce framework change in healthcare. So instead of paying, effectively the revenue model in healthcare today, or the reimbursement system is, you show up, we help get you rehabilitated, back, restore your function, get you better, and return you back into the community, and healthcare systems are reimbursed for that. The model in the future moves to one where it's really around healthcare systems behaving more like the insurance industry, where we actually own the risk on a population of patients.
So it's the wellness approach.
The
way in car insurance companies will reward points for, better drivers, that sort of thing.
Spot on, exactly. So marrying those two together create this multidimensional approach to the change of healthcare. But marrying the two is very challenging. Of sort of changing the model, because when you change the model, it means changing behaviors, changing the operating model, changing the way people have consumed information in the past, changing the way people are expected to use information. It's a complete transformation, if you will, of the system, and it's one that technology is central to. So when you walk into our IT building, we have, my team has been gracious enough to sort of put together, there's a quote that I have, and it says basically that there's not one goal, not one objective, not one target, not one answer, not one sort of destination in the future of healthcare that will not be enabled through technology. And that's central. Technology will shape what healthcare will look like.
Well, and I like the way, too, you've got another quote that I've seen attributed to you is about positioning your IT group so that they self-identify as those strategic enablers. Now, that didn't happen overnight. How did you get to that point where they really started, the IT people really didn't see themselves anymore as like the electronic health record people and somebody that were apart from the whole system? And you've been at Christiana Care for over 9 years now, so you've got longevity on your side there. In fact, you've got twice the average tenure of a CIO, according to our State of the CIO research. So you're doing something right. And how did you get the IT group on board to become those strategic enablers? What kind of things as a leader do you do?
Yeah, well, part of that, there's the connecting to the mission of the work that we do.
Yes.
And so, and we also, we call our technology folks, they're caregivers behind the caregivers. They may not lay hands directly on the patients, but if you walk into any care setting, they're using technology. And that technology is powered by the caregivers behind the caregivers. So
Yes.
caregivers, the first-line caregivers, whether they're administering medications, whether it's even a ventilator. I mean, those ventilators are powered by technology, and every asset that's deployed to it actually has an IP address.
Yes,
On
of
them.
course.
So
Yeah.
you sort of think about that transformation there. But there's actually a couple of signals that you can even leverage when you actually look at the type of relationship that the IT function has with the business. We'll call it sort of the different areas, clinical or operational areas of sort of the rest of the business. There's a demand signal, which is we need you. We are trying to drive our strategy, and inherently we need IT at the table to do that work. So the IT folks, where in a way in the past, right, they would respond to demand, they now live at the proverbial sort of table where they're actually helping strategies shape what the future looks like. So helping people kind of understand that, connecting to the work, the vision, and that what they do is an enabler, helps them connect to that work and shift, and that they are really effectively caregivers behind the caregivers.
Well, and it's reminiscent, too, of the way that IT CIOs and their IT groups used to be an afterthought in mergers and acquisitions. And today it is the rare organization that doesn't get the fact that they need the CIO at the table when all the discussions are going on. Now, you've been involved in something like $5 billion worth of mergers and acquisitions Have you seen that happen yourself? That move to bringing the CIO into the table earlier?
Yeah, I was fortunate having gone through a number of M&A transactions, both sell side and the buy side transactions, and first, interestingly, there's an element where I think leaders of an organization can get on board. First is, when you're in the world of doing diligence on a potential target, and there's this universal truth that I discovered in doing that work, and that it's such that when you do diligence, you're doing diligence as an outsider, right? It's the information that's been provided to you. But when you get to that day of closing and the keys are turned over to you, you get inside the building, if you will, proverbially like buying a house, and you really discover, boy, I thought the windows measured X and they measure Y, and the curtains are really going to have to be a different length than we anticipated. And around that, what I've discovered is really about 60% of the assumptions that you make doing diligence from the outside really are imperfect. Right. But the challenge is, you still have to make a commitment in terms of synergies that you can bring to the table, and you're obliged to still deliver those synergies. So that's key. And the second piece to that is, I think CEOs recognize there's some that want a number of day one things to happen, right? And day one, T minus the acquisition, once the keys are turned over, they want to see certain things like a unified email platform, if you will.
A very fast onboarding for new employees,
very much
all
to
that
communicate.
kind of things. Yes.
But I think this third aspect is the integration, because there's also customer risk, right? That people fear no disruption to the value chain. And that takes IT to be able to sort of connect information together.
Sure.
So we always took the approach in a prior role, right, where we spent sort of the first 12 months connecting the back end of the organizations together. And then we spent the second 12 months, if you will, or chapter 2 of the story, was about connecting the front end, the things that touch the customer directly. CEOs, I think, that understand that and get that realization, and also that need to unlock the value, right? There's doing the transaction, and then there's delivering the value that you committed to.
Right.
And they can't get there without having great technology partners.
Do you think today that the chapter 2 might come first again, where you do the initial connection up front while you're maybe simultaneous while you're working on the back end integration? I don't know how possible that is. I made it sound like it's a snap.
I'm going to bet
it's
that
not.
there's organizations out there that have mastered of how to do that, to connect both at the same time. And part of it may, depending on the back end type of systems and the risks associated with those.
Yep.
So living in a world where we're dealing with human beings and incredibly high risk, and ensuring that you need to have high reliability performing systems,
Yes.
electronic health records. So we're really really thoughtful in that approach in how we do that. So we make sure that stuff is done right before moving on to sort of any chapter 2.
Okay. The when I always ask about customer expectations, and in your case, patient expectations in healthcare. And
Let me challenge you on that one as you're framing that
all
question,
right.
which is actually
That they are the customers
We are
now?
rethinking is that really it is consumer driven. So in framing your question that way.
around consumer expectations and how what they get delivered from Amazon and Apple and Facebook, how you're seeing that change and impact things in healthcare as a CIO.
So it actually feels in a lot of ways obvious in so much as you look at everything else that we do in our lives is done with this technology platform. The challenge is that when you walk into healthcare today, you historically you put your device down, and it's not a participant in your healthcare. So now
Great point.
today, we've deployed the portal and apps for you to be able to interact. And now it's about building is actually taking the care pathway and moving the care pathway. So you think about that care pathway. What is it like to be that cardiac patient that's discharged? What is it like to be a diabetic? What's it like to be a COPD patient? And then how do you actually rebuild or refashion care that's been traditionally done through physical assets and rebuilding it in a digital fashion? So think of this. So I frame out this sort of concept. Think about today in the world of manufacturing where I came from. We have a bill of materials, and raw materials move through work centers.
Inventory control and all
they
that
have
sort
value
of thing.
added, and they go from basically a raw material to a finished good. So in healthcare, as we're rebuilding what has been a physical supply chain to build everything digitally. So I put forward this sort of concept that everything that can be packaged digitally will be packaged digitally. So think about this concept of elements that were done historically or still today that are done sort of under a physical model. The bill of materials is moving digitally, and as they move to be done digitally, so think about the care interaction. Instead of going to the doctor's office, you do a virtualized visit. What happens is that work that was maybe owned by an operating leader actually now shifts to having a digital bill of materials. So more and more of the physical components that were bill of materials will move over time to a larger component of the total delivery of care will be digital bill of materials. And that's a fundamental change because the CIO then becomes often the owner of those processes. So how do you then think about building competitively differentiated processes that are basically valued by the consumer in healthcare that matches them where they are in a new digitalized supply chain to deliver those things to people where they are?
And the more digital the supply chain, especially in healthcare and a few other industries like defense, the more the cybersecurity risks also start to rise. So, how is that set up at Christiana Care? Do you own IT security along with all those others? You have so many hats; it's hard to keep track.
Yes. So IT security is part of the function that reports into me. I think what's really a couple of elements that are important here for us. One of which is when we approach security, it's about, as we think about the future, security is at the table instead of an afterthought. It's built in from the core. So you harden your thought processes with hardened security in that way. There's this realization, obviously, as you think about as the venue of care shifts and we build that reversal of the information supply chain, that we're going to have to gather data from the patient setting and consume it, right? Mary Fran, you're generating the number of steps you've walked or the temperature of your body temperature, how many times you've gotten up and down today, all these other factors and other diagnostics that we can measure on you basically with, small diagnostic devices today produced by the world's largest medical device companies. So as you think about integrating all that information, we think about that from the standpoint of how do you gather it securely, reliably? How do you establish provenance around that information to know where it's sourced?
Because it's hard to imagine anything more personal in your data.
And yes, as well, and giving patients that granularity of control about what information they share, and that will always be the case in healthcare, which is patients own their data, and they have to have the right to control that information in a granular way. So we build all that and design that ground up, which I think is probably a shift from the sort of an era in the past, which is security has been about defending the borders, and now security is really about baking it in from the outset and protecting and respecting that data for what it is.
Well, and when we think of the changing consumer and patient expectations in healthcare, you had a great story about seeing the generational divide between, the baby boomers, my people, the baby boomers, and then there's yours, the Gen Xers, and then we have millennials and the younger around there. And tell that story, because it involved your boss, and those are always great stories.
Yeah. So, we have an amazing CEO, Dr. Janice Nevin, and as we were strategizing and thinking about, we're going through a strategy planning work, and we get ourselves out about 8 years in front of where we are, and it gets us out enough to sort of get off road. People sort of can unmoor themselves from today's world, and then we work our way backwards in that thinking from a strategy planning. Think about, boy, if we need to be capable of X in 3, 4, 5 years, you then have to start backing up and thinking about it now. We were going through sort of that strategy planning cycle work, and thinking about how the shift to virtual will take place. And Janice and her daughter were in the car together, and Janice tells a story that there was a billboard, and one of these billboards, it talks about emergency room waits, and it says, emergency room X for the hospital down the road has a XYZ wait of 32 minutes to in the emergency room.
The way you'd see traffic signs on the highway.
Exactly, yeah. These billboards, and it'll have that the LED digitized element
thing.
to give the count. And interesting, Janice's millennial daughter turns to her and says, "Why on earth would you advertise that you have to wait?" And
there you go, boom.
It became sort of this full circle, enlightenment moment, and it's that realization that the nature with which we're going to be competing, if you will, in the future, is really on glass. The screen in front of you, and less about the real estate. But the magic, the power comes in the connection between the glass and the physical nature, which is in, say, for example, in virtual care, which is, Mary Fran, wow, it's great to see virtually. I don't like the sound of the cough, which means we want to get hands on you, or we think it deems that it's relevant to choose wisely and have an imaging study done. And that's where the magic lies in. And all of this comes back to that sort of key question around the consumer and digital in healthcare to create what we'll call sort of this frictionless model of healthcare. And this is where we have thought about the issues around consumer and convenience.
Yes. Well, and when you think about so much innovation is built into everything you've been saying up until now, and I think that your approach to innovation has got multiple pieces to it, and I'll bet it's changed a good deal in the last 9 years. So between when you arrived at Christiana, 2010, and then now, how has your approach to essentially funneling your IT group into various innovation areas, how has that changed? What's different today?
Well, I think first, as you think about the connection to innovation, it needs to really be connected to, as we think about kind of the how we forecast potential futures, what the future may look like. And we don't try to predict the future. We try to really forecast what various futures may look like in that work. So I think early on in my world of innovation, you were more technology focused, and much more today it's really about this sort of, instead of thinking about it from the supplier, the production function of being able to sort of like take a technology and deploy it, we focus much more around sort of, I think, the consumption function around how can these technologies create value, but more in a demand-pulled perspective. So it might have been in the past where we created an interesting sort of use case that might have been connected to something that wasn't necessarily a problem.
Well, yeah, I often hear that referred to like there'll be especially a newer, more emerging technology. I've heard blockchain referred to this way, that it's a technology in search of a problem. But it's probably a lot more than that. It's probably a more sophisticated approach to it. But you had mentioned doing innovation with intent.
Yeah, so so building on that, it is this innovation with intent. And it is about creating solutions, where does friction live? So let's, for example, we have this sort of thing. We've declared a war on inconvenience, and we think about healthcare and this concept of how do you generate radical convenience. But then, so think about from an innovation perspective, the problem sets that we need to solve. So we have 3 vectors or 3 arms of innovation that we focus on. And what's first important is that these are not laboratories producing something that doesn't have a problem. It starts with a demand thesis.
So it's not an R&D sandbox where somebody's playing with the latest AI.
So I'll say there is an element. There's a piece of that. So we have to have a piece where there's an entry point for technologies to sort of think about some bold, forward-looking cases, and that's a piece. And that capability is important. But if you ran a bunch of technology, that's ultimately not sustainable because things have to get integrated back in. It can't be just an area that builds prototypes that never go anywhere.
Right.
So we have an innovation arm that focuses first on, as you think about the core systems of record that all CIOs have accountability for running. There's
the
gaps.
part of the iceberg that's under the water.
Exactly.
Yeah.
And there's gaps that live when you think about those competitively differentiating processes that you have. In those, how do you optimize each of those areas? And there's gaps when you think about going system to system. So we have a team that focuses on closing those gaps, and we sort of casually call that team kind of a gap-applications group.
I think that's very cute,
well.
actually.
And then we have a group that focuses on those systems, if you will, those strategic partner systems that we call the sort of the scaffolding of the organization that we build. And these are the ones that help us produce sort of the products that we produce, which are clinical outcomes and helping people return to health. And so that second arm focuses on those partners, those large systems, the big sort of brand.
And that's doing proofs of concepts and pilots and that sort of thing.
Yeah, in a way, it's helping get us outside. I think take for example, if you take your an ERP vendor, if you will, a cloud-based ERP vendor, and the team that supports that might have a list of 200 or 300 things on their list that they have to get done. Our internal team, you got to deploy a field here, we need a change made here. And what we're trying to do is rise above that to really look at those assets and those partnerships in a strategic way. To say, for example, we have 600 vacancies in our organization. How can our human capital management partner help us think about those vacancies in a different way, in a way that they may not have solved yet? And so maybe it's unique to healthcare. Maybe it's unique to healthcare services. Maybe there's certain ways to uncover information there. Maybe there's a way to build a tool set. So it's about coming together because we also realize the era of doing things yourself is over.
Right.
And so it's that ability
why
to
would
move,
you? Right?
Why would
Yeah.
you? So
why
you
would
can
you?
moving further, moving faster with others. So that work is that team that focuses on those partners to extract a different level of value and co-create together.
Is that also the way, do you handle your vendor management, like your vendor management office through that group, or is that just a whole separate function?
We have a separate VMO function that works, but there is deep integration because you're having to craft actually partnership relationships that aren't typical again with an end user license agreement or some other. So we've actually had to produce agreements that are really about IP monetization scenarios. Like how do you capitalize on that?
Yeah.
And we've had to then establish governance around those to determine with those partners when you do that work, how do you want to handle it?
Yeah.
And that requires actually a very close partnership with your legal counterparts to do that work. Right? We can't. Our vendor management teams don't pull that off alone. IT, innovation, we don't pull it off alone. So it involves having a great partner. And then sort of coming back to the third arm, Mary Fran, on innovation is this third piece that we call sort of this applied innovation group, where we kind of focus on clinical type innovation work in the context of business model innovation. And in that case, for example, it's working with, say, brand name medical device manufacturers around participating and taking risk on an outcome with patients. And not just, you'll save 5%. This is about real meaningful outcome, about producing the outcome and taking real risk associated with sort of the clinical claims that come behind their products.
Yeah. Do you have an example of this? And say in the last year or so? Where
So say for example, if you were to take a particular disease state, let's just say, for example, you had a population of patients with diabetes, and you could take a particular asset and you could put that asset, like an IoT device, on somebody, or a particular glucometer. And if you were standing behind your building, you build the care processes, the care pathways, you digitize, you determine where there's information that's generated, where does information need to be consumed, whose workflow does it sit in, and you build the whole architecture behind that. And then you think, okay, well, that's great. We believe that you can achieve a particular outcome, high tech, high touch, better than every 90 days with a diabetic if you built a different model. And if you do that, but if you don't get that outcome based on everything that you've built and using that technology, maybe you don't pay for that outcome.
Okay.
Or maybe a patient isn't accountable for paying for a co-payment or something along those lines if an outcome isn't derived. But it means something really different. It's about taking your supply chain, your value chain partners that help you produce an outcome, and it's having them share in the same risk that you're basically shifting to under a new model of commerce and healthcare.
Interesting. I also wanted to ask you about, because I mentioned blockchain, and for the last year and a half to 2 years, I've been asking every CIO I run into, are you doing anything with blockchain? You know, what's in it? And I'm starting to hear some interesting stories come out of it. Like there's a CIO of a food company out in California, and they're using blockchain to track from the moment they pull a fish out of the ocean to when it gets to a restaurant table. And I heard another one with Christie's, the auction house in New York, where they used blockchain to track an entire collection that one of the uber rich art patrons had bought. Is there anything you've done with it so far that's out in the real world, or anything that you think holds a lot of promise?
Well, I think as you think about this concept in each of those examples, the immutable record that's produced, and there
the
are
record everybody trusts.
There
too.
are records, and I think that that value add for blockchain is this where parties distrust each other, where you have mechanisms today. Some of the use cases that have been generated so far are ones where it's kind of replacing an existing system, but the parties generally trust each other today. So here are some great use case examples in healthcare. Think about this concept of pre-approval on a patient. Like, we need XYZ done, you got to go to the insurance and get the pre-approval. So imagine the model whereby you've taken sort of the transaction of everything that's sort of been done through the EHR from the interventions in the patient. And if that meets sort of a defined clinical standard that meets for basically an approval, if you will, so you reach the point, say we've done A, B, C, D, it's immutable, right? It's real time, it can be audited in such a way that pre-approval is already delivered by the time the patient reaches that next stage. And maybe it's a patient that needs to undergo a chemotherapy treatment, and maybe instead of waiting X number of days, you've demonstrated all those things, and without sort of having to assemble the paperwork Bible, if you will.
The wrestling match with the insurance company.
In a way. So there are real opportunities to do that. And what we want to do is focus on how do you build those in a way that really creates value for the participants, starting with the patient who's vulnerable at this point in their life where they need help. And then how do you then align all the other sort of vectors needed to get that delivered for people?
How do you streamline essentially a process?
Yeah. So there's a lot of great examples. There's everything from credentialing in the healthcare industry to others that will be transformed via blockchain.
Yeah. But that is the future that we'll bring to today, but it's not the today. We're not really there yet.
Yeah, I think there's a lot of experimental models happening.
Okay.
That are there, and the healthcare industry, there is a sort of this pace because of the work that we do, and that we are a high reliability industry, that we really figure out how to reduce sort of what becomes sort of the tolerable sort of things before you can sort of go live with something.
Right.
At that rate. So it's a very thoughtful and a very data-driven industry.
Yeah. Well, and that's actually very reassuring. It's like when I hear CIOs of banks talk about how carefully they're proceeding with something. You think, well, good. I mean, you're in charge of financial health in this case.
Not dissimilar.
Physical health. Yes, exactly. I want to segue into talking a little bit about your your triple threat role, your expanded role in strategy and in digital transformation and in all the other IT stuff. As you're essentially the chief digital officer, so you have that role where you're busy transforming the business going forward. You also have a strategy team and a strategic role, and then you have that whole co-innovation venture partnership area. Talk about how you balance those and how you do all that plus a CIO job as well.
Well, I mean, first, and this it may sound trite, but right, you have to have great people. I think in part of that ability to replicate myself,
Yes,
is the ability is only accomplished by having great people that are with you. So I think part of the as you sort of look to where every industry is moving through change, and as you think about as we move in from a healthcare perspective, a lot of where we're going, right? There's no playbook that we can pull off a shelf and say this is what you got to do. So that connects. So that as we cultivate sort of those strategic forecasts of what futures look like, and then what becomes competitively differentiated for us and how we create value and reach. And that means for us, competitively differentiated in our world means how can we actually help people, accomplish a restoration of function faster than everybody else? How can we actually move faster from sort of symptom to diagnosis for you faster? And those become really important. So I call them competitive, but they're all really important value-added things for when you're in that point in your life and need help. So part of that is spending my time and understanding strategically what is the world going to look like. But because those futures don't exist necessarily and with a playbook or what we know, and the technologies may not exist, that's where the innovation piece comes in.
Okay.
So we're making bets and trying to sort of have some experience or some capability around what those future tools will need to be. And then all of them are delivered and operationally supported from a technology perspective.
Okay.
So the three actually really dovetail quite nicely together, and it makes total sense, and I think it allows us to move faster as an organization that we have the integration between the three.
Okay. Well, I have one of our rare occurrences. We're open on, of course, we're doing this live on Twitter, and we have a question that came in for you. And this may play into the work you do with the medical school at Dartmouth, but basically it's asking about your knowledge on tissue engineering and its applications at the hospital. Is there a data role in there? Is there an IT role?
So there is a technology and platform run that does tissue analytics.
Okay.
And there are things that are done by some of the clinical domain groups, things like that around cancer and things like that that do tissue work. So there is a role for that, and there are tissue samples that play a role. I think what really becomes important as you think about the marrying of genomics, sociodemographic information, and the information that sits in an electronic health record about you as well, the combination of those things together begin to charter what the future of healthcare looks like. And that any added data that you can bring in, whether it's tissue sample data or anything like that, will continue to serve the public good about the ecosystem getting smarter.
Yes.
So, and there's this deep complexity. The amount of knowledge that's generated from a healthcare perspective, there's roughly about 900,000 to 1 million or so peer-reviewed articles that are expected to be generated this year.
Wow.
And that has been, if I'm recollecting properly, roughly about every 5 years, almost a doubling of that number. And there's some crazy stat that I read that says something around if you graduated medical school today and started to read like 2 peer-reviewed articles per night, it would take you about 1,250 years to catch up. So you couple that then with the complexity of a patient moving through a healthcare system and all the knowledge that's being generated. The only way that we're going to be able to bring the knowledge basically to ride along with the clinicians is going about bringing the analytically assisted information to every decision and allowing the clinician, the care team plus the family, and the patient to all come together to make a decision based on all the available information. And a partner in that information set will be the analytic component, the algorithm that moves alongside.
Well, and in some cases, it may be driving the decision for everybody because of the information that it essentially brings you. We talked a little bit briefly about specifics on key projects in different areas, and you summed it up very nicely that the 4 themes you have governing all of the work you're doing is consumer, digital, AI, and cloud. And we've touched on a lot of these, but not said a lot about AI. And you have, today we seem to act like we all of a sudden discovered AI. It's everywhere in the media, business media, and in tech media, when in reality it's been around for 20 plus years. And you've been doing things with AI data and devices since 2014, yes?
2013, actually,
2013,
yes. And we kicked off in 2012.
Yes.
And yes, so and for us, it was starting to connect these, those data points to be able to do a predictor. I will tell you, this is a really interesting learning lesson for me in this, was when we began this first initial sort of this desire to predict. We started out, and we had sort of our clinical research partners were also going to sort of at the same time try to figure out if they could make a prediction, which would have been sort of the traditional way to do that. And what was interesting is our clinical partners, they sat down and the clinical researchers, and they said, okay, what variables do we want to include in our study? And this is interesting. And they had to pick a set of variables. From an AI perspective, we didn't pick a set of variables. We just said, let's vacuum in all the data we have.
That's right.
And what was interesting is it was this realization of this fundamental flaw, because when you begin the question, you're already isolating yourself to a limited sample of potential variables. And AI completely blows that out of the water, and it allows you to vacuum in effectively what's your limit? Storage, processing power, right? And if I can buy elastic computing and put stuff in the cloud, it's really your only limit is effectively is your ability to maybe gather the data in some way. So I believe this is going to be so fundamentally different that the healthcare that we're experiencing not too far off in the future, 10 years out, the way analytics will be engaged and partnering, we will have analytically assisted everything, not just clinical workflows, but operational workflows. Everywhere, and it'll be on a device, and it will tell us in the workflow, here's how to optimize what you're doing today, and delivering those insights.
Yeah, I had a very similar conversation with the CIO of the Broad Institute with Bill Mayo. You probably know Bill, and he made that same point, that the way you used to gather your data and go about it, he says it's all reverse now. It's where you just you throw it all in, and then you let the artificial intelligence have at it.
Effectively, yeah. I mean, you think about traditional, enterprise, ETL process, and you can actually flip that around and think about doing the data transformation really at the end, at the point when it comes down to the sharpest end of the spear, to knowing what's the exact question that I have on this data, rather than transforming it at some earlier point under some broader definition that may or may not be appropriate. And I think there's an incredible power in that, to be able to then get very specific on the question.
That's actually a great way to think about it too, because that one of the few things I know about data analytics is that extract, transact, load, and essentially AI reverses it, where it's load, transact, extract.
Exactly.
That's a really cool way to think about
fundamental shifts. I think what's really amazing is, you think about all these paradigms, right, that we've been limited by because of the technology capability, that completely, when the technology is there, it completely flips them upside down.
Yes. All right. Well, we are unfortunately right at our 45-minute mark, when I'm supposed to pull out of the artery here and stop asking you a bunch of questions. But I have to ask you one last one about leadership lessons learned. You mentioned lessons a few moments ago, that whole balancing the competing demands on CIOs, which from my perspective, they just seem to get bigger and bigger and bigger. What are some of the things you have learned over time about that has made your CIO role so successful?
I'll tell you, there's 4 things that I have on my list. I'm holding up 5 fingers.
And I only needed 3, so this is an extra.
So for me, it is courage. You need to have the courage to lead the change. Empathy. You need to have the empathy as you're making those decisions, to understand and think about people that are impacted, and understand what that means in first-order consequences, second-order, and unintended. Third for me is reflection. and that ability, and that really means about reflecting and learning from what's taken place. And that's often one of the hardest pieces, to get the capacity to reflect. And so I have to work hard at doing that, but recognizing it's one of the assets that strengthens everything else. And then the last piece is gratitude. And it's that ability to be thankful along the way. We just this past weekend, our team went through a massive upgrade on our electronic health record platform to the latest version, and you wouldn't know we went live.
Really?
And that's what's amazing. So we talk about this concept of really, like, we want our go lives to be boring. We
Like,
don't want,
oh, yeah, you just did that.
we just did that. We just did that. And so, thinking about all of those components together, and instilling that in your team and your organization and expectations of others. So we think a lot about, values and behaviors. And as a health system, we did something bold. And we talked about, for us, our thesis is that we serve together in excellence and love. And we built an operating system that's based on those.
That's excellent. I really like that. You must not have any kind of when you need to have a kind of a mission-based approach to how you recruit talent. That piece must be easy. I know it's never easy to find the great talent, but
well, it's nice. The line is shorter between work and meaning.
Yes.
When you're in the space, when you're doing a public good, and that's very powerful.
All right, beautifully said. Thank you so much
Thank
again
you for having
being
me
here.
And again, thank you to your team as well. Thank you.
Yes, you're always welcome, and I'll be seeing you next month at our CIO 100 when we induct you into the CIO Hall of Fame.
I'm looking forward to it.
Yes,
Thank you so
me
much.
Too. All right, if you joined us late, do not despair. You can watch the full episode later today on CIO.com or our YouTube channel. And you can also listen to my conversation with Randy as an audio podcast wherever you get your podcasts. Please plan on joining me for our next episode. It will be about a month from now, Thursday, August 15th at 10 a.m. Eastern, when I'll be joined by Scott Blandford, who is the Chief Digital Officer at TIAA. And please subscribe while you're at it to our YouTube channel, which is called IDG Tech Talk. You can find all the previous episodes of CIO Leadership Live on there as well. Thanks so much for joining us today. Take care, and we'll see you soon.